Something we all need, it's something we all want, but it seems sleep is something many of us just can't get enough of. We've all been there. The tossing, the turning, the midnight moments when sleep just doesn't come. According to the National Sleep Foundation, a good night's sleep is something many only dream about. They report lack of sleep affects more than 75% of all Americans, who often pay the price during the day.
Even stopping at a red light, I can doze off. That's how tired I've been.
Sleepiness is linked to car crashes, lost productivity, and proves to be a risk factor for everything from obesity to attention deficit disorder, even marriage troubles. In fact, trying to sleep next to someone who snores could actually cut years off your life. Just last month, the British Sleep Apnea Association found people who share a bed with a snorer lose 2 hours of sleep each night, which equals 2 years of sleep over the course of an average relationship. Almost 90% of those surveyed say if they could cut the noise, their relationship would be better. So just how many sheep should you count before the sleeping situation becomes a real concern? Currently, the American Academy of Sleep Medicine has classified more than 80 sleep disorders. The most common is obstructive sleep apnea, or OSA. Few people understand the serious nature of this disorder. Sleep apnea is a potentially life-threatening condition that occurs in all ages groups and all genders. Dr. Paul Teman is with University Healthcare Sleep Wake Center, and he joins us now with more. Thank you for being here.
No problem.
I think a lot of people have heard about sleep apnea, but what exactly is it? How does it happen?
Well, you're right. It is a sleep disorder. It's one of the more common sleep disorders that we treat. And what happens is when you go to sleep, normally the airway, the back of the throat, the medical term is called the posterior oropharynx, gets a little narrow. And that narrowing causes snoring. Well, snoring for most people isn't a bad thing. It can be disruptive to your spouse's or bed partner's sleep, but that snoring tells me that that airway is getting narrow. And in some people, when that airway gets narrow, and it can get so narrow that it actually obstructs, closing off, then you don't get any air down to the lungs, and your oxygen level drops down, and that causes your brain to wake up, and sometimes it wakes up repeatedly throughout the night, and you might not be aware of it because this is happening while you're asleep, and you might not wake to full consciousness, but what happens is it doesn't let you get into that deep restorative sleep.
So oftentimes people won't even know they're waking up. They could wake up in the morning perhaps and not feel rested or not feel completely like they received a full night's sleep even when they have.
Some people notice that they wake up, they snort themselves awake, or they wake up gasping for air. But you're right, other people, they don't know this is happening. Sometimes it takes their spouse or their bed partner to tell them that, you know, you actually wake up during the night.
You jolt yourself awake
exactly
with the sound. You mentioned snoring as one of the symptoms and signs. What are some other things people can look for?
Sleepiness. Even if you get a full night's sleep, most people need about 7 to 8 hours of sleep per night. And if they're getting that and they still wake up feeling like they didn't get any sleep, that's one of the main problems.
I read that it affects 2% of all women, 4% of all men. What are some of the risk factors that would make people susceptible to this disease?
One of the main causes or risk factors is being overweight. If you gain weight here, you tend to gain weight in your neck, and having a larger neck size increases your risk. It does tend to occur more in men, but I think we look for it more in men. We consider, I think, maybe snoring to be kind of a man's condition.
A guy's thing.
Yeah, and I see plenty of women who also snore.
Sure.
Insomnia actually could be a symptom of sleep apnea. It's really difficulty staying asleep because you keep waking yourself up. We're
looking at a list now of these risk factors: hypertension and family history. If you have perhaps a relative that has been diagnosed with sleep apnea, should you consider being checked out?
Correct. If you have parents or siblings that, for example, snore or have been diagnosed with sleep apnea, and you yourself snore or are sleepy during the day, this is something that should be evaluated because it does affect quality of life, and it also, over many, many years, can lead to, it's a stress on the heart, and can lead to further problems like heart disease and stroke.
We tend to smile and joke about the snoring, but it really can be a health concern for many people. What can be done once you have been diagnosed with this disorder?
Well, once you're formally diagnosed, you have to go through a sleep study. The main thing we use to treat sleep apnea is something called CPAP. It stands for continuous positive airway pressure. Basically, it's a device, and we have I have an example here. And this is actually, this is a humidifier. It keeps the air nice and moist. And the actual device is right here.
Oh,
so
very
it's
small, very compact.
Very portable. I see people bring them on planes all the time. And the only reason I know is because I can see the name of the manufacturer. So
Sure.
it's very discreet.
Can sit on your bedside.
Sits on the bedside, and then this hooks up to a mask. Usually the hose is a little bit longer, but this is some examples of masks that, and this plugs into the nose, and there's ones that go over the mouth also. But at our sleep center, we fit people, so we specifically tailor this to the face.
So different masks for different face shapes or different preferences.
And you have to be fitted for one. So that's what I like about our sleep centers. We see people back repeatedly until they are comfortable using this, because this is the main treatment, and we want to make sure people use this. And it's something that sometimes it takes a while to get used to.
Take some adjustments for sure. I know that's not a working machine. How loud is that machine?
Very quiet. It's about as loud as a fan, like a fan blowing in the room, or air conditioner.
Okay. And people might be hesitant the thought of sleeping with a mask. Like you said, different fits for different face shapes, different options if you are interested.
This is the main treatment. The treatment really depends on how bad is the sleep apnea. So if it's in the more severe form, this is the main treatment, but in milder forms, sometimes sleep apnea occurs exclusively when you're on your back, and so one treatment is staying off your back. There's surgical approaches. There's these things called oral dental appliances that are made through a special orthodontist, and you put it in your mouth and it pulls the jaw forward like that.
So a lot of different options just to clear those airways and get you breathing and most importantly sleeping again at night. And again, more than just the noise, more than just the snoring, definitely some health concerns associated with sleep apnea. Well, thank you so much, Dr. Teman, for sharing this information. If you have more questions, you can contact University Healthcare Sleep Wake Center. There's the website, and of course the phone number 581-3067. They can help you out with any questions you might have if you think you or perhaps someone you know is suffering from sleep apnea. Thank you again.
Thank you.
Coming up.